Hello everyone, welcome to Wellness by Ridomaxx. I am Nandini Rathi. At Ridomaxx, we blend ancient herbal wisdom with modern science to create supplements that help joint mobility, muscle recovery, and overall well-being. The goal is really simple, to help people get moved freely and live fully. Today's episode is extremely special because we're addressing something that's really common in every household: knee pain, back pain, muscle pain, stiffness, and slow recovery. With us, we have is Dr. Rahul with a 12 years B.P.T experience. He also is the founder of Empower Physiotherapy Clinic. He excels in orthopedic and sports injuries. Mr. Rahul, welcome.
Thank you, ma'am.
Yeah.
Nice meeting you.
So, Mr. Rahul, a very basic question to answer the concern of anybody watching. What is it that this episode is going to bring to them so that they should continue?
Correct. See, so there's a vast variety of information that exists out there in Google, in ChatGPT, wherever you find. You just open your phone and you can just Google your symptoms and just come to an understanding of it. But there is a difference between information and wisdom. So everything that if you just read about your symptoms, it does not necessarily mean that it applies to you. Because there's a lot of permutation combinations as to whether that the symptoms actually apply to you or not. And there's a lot of filtration to do. That is actually done by a healthcare professional.
That is true.
So, what I think you can actually walk back at the learning of this episode is you will understand when to approach a healthcare professional, when to just rest it out.
Right. Okay. So let's start with the basics, doctor. I suppose this is something extremely common. What is the most common root cause due to which people experience knee pain and back pain and shoulder pain?
Right.
Yeah.
So, ma'am, it is contextual, but if I have to put it into basic parameters, I'd say it is like this: posture and strength. Let's say we talk about back pain. So most people who work in the IT industry or who sit for prolonged hours in front of their computer, they usually, whenever we sit, we do not tend to sit straight. We tend to sit slouched. On a long term, I would say it is, if you are not equally complementing it by, doing a regular amount of exercise and, exercising your back and spinal muscles, what is going to happen is there are going to be wear and tear changes that will happen as you age. And these wear and tear changes will get sensitized and you will end up having back pain. And if you have to dig into back pain or knee pain and all this, it goes into too much of medical jargon. So I want to avoid that as much as possible.
Okay. So there's also one really big confusion in the age groups these days. If somebody has a knee pain, they justify it with, abhi meri umar nahi hui, wo nahi hoga, it's not a big problem.
Ji.
How does one track? Is it because of injury, some kind of deficiency, or is the bone or joint really degenerating?
Right. Now, this is also contextual, I would say. Basically, see, when you're having knee pain, why is that knee pain happening? Has it occurred because you fell, you sustained an injury, or has it happened because you started some form of a new physical activity, whether it is running or jogging or some sport like a badminton or pickleball that you picked up and you're starting to have knee pain? So I would say, why you usually tend to have these pains is you have to look at it this way. Any physical activity that you have to do, it is like you have to prepare for it.
Correct.
If preparation, what I mean to say is it can be exercising and preparing yourself for that activity. It can be warming up yourself and preparing for that particular physical activity of sport. So, it is like that.
So it's not age-related in today's time, knee pain, as it's generally said.
Well, I can see, like again, I'm telling you, knee pain, there are many reasons as to why people have knee pain. Even younger people get knee pains. So just because you're getting knee pain, you should not, shackle yourself with the fact that now you have become old and you're having arthritis. There are more than 10 reasons as to why you're having knee pain. Even younger people feel it. There is one particular condition called as chondromalacia patella. So why people have it? It happens in people who have, like I would say, who overstrain their knee. Like that. So it is not necessary just because you're having knee pain and you've read something on the internet that the knee pain's reason is arthritis. It does not work like that.
Okay. So there's always this confusion of a person to understand which doctor should they approach. Say, very recently, I had a shoulder neck problem for like 20 days. But I was really confused whether to go to a physiotherapist or to go to an orthopedic doctor. What happens generally, because y'all as physiotherapists are really available for us, it becomes easier to come down and get it checked. I realized midway that maybe because of some kind of deficiency, the myofascial treatment that you do, physical treatment that you do with the elbows, it did not suit me. So when is a good enough indication for a person to understand should they now diagnose with an orthopedic doctor or come to a physiotherapist?
Right. So it is this way. When you have any muscle or joint related pain, you can either approach a physiotherapist or an orthopedician. Now, if you come to me, if I feel like there are some red flags, by red flags I mean if I feel like you are not a suitable candidate for physiotherapy, if I feel like you need a little more evaluation, if I feel like your pain is not exactly coming from the joints or there is some underlying deep-rooted cause to it, then I will defer you to a particular specialty where if necessary it can be an orthopedician or it can be a neurologist or it can be a general physician. Ma'am, when you're in pain, I would say you can directly walk into a physiotherapist clinic or an orthopedician. Speaking of that, but see, either you go to a physiotherapist or an orthopedician. Even if you come to me, I'll screen you thoroughly. By screening, I don't just mean when you walk into my clinic, I'll tell you, yeah, you need this treatment for these many number of days. It does not work like that. I will examine you in detail. I'll take an oral examination from you. I'll understand your symptoms better. Then I will physically examine you. If with this filtration process, if I feel like your pain is not coming from a mechanical standpoint of view, when I mean mechanical, I mean it is not coming from a joint or muscle, and there is some underlying deep-rooted cause to it, like in your case, it was vitamin deficiency. Then, it will basically, I'll understand it when you're talking to me only about yourself.
Right.
So then I'll tell you, no, ma'am, I think you should first go and see a physician. Just get these symptoms ruled out. If that is what is bothering you, you get that thing corrected. And then if it is still bothering you, then you come to me.
Makes sense. So is there an early stage where you can identify that you're seeing a decline in your joint functionality? Is there a sign or something that people on repeated basis can observe so that they're aware that, okay, this is what my body has come to and this is the step I have to take now?
Got that. So see, this symptom that you're telling, whether it can be the knee joint or your back or your ankles also, usually in your late 30s, in your early 40s, or most commonly in your early 50s, these symptoms of joint decline are commonly seen in patients. But that doesn't mean that it indicates that you're having a very severe arthritis where you have to land in the OT table of an orthopedic surgeon. No, it doesn't work like that. So most of the times, motion is lotion for the joints. Once you feel like you are developing some sort of muscle ache or a joint ache, if it is clinically suitable, then a physiotherapist will usually tend to treat it. If it is not, if it's just some mild ache in the muscle or joint, then I will tell you, no, ma'am, I think you should, it's time you start exercising if you're already not doing that in the first place. And then, I'll encourage you to be more active and have an active exercise-oriented lifestyle.
Correct.
Like that.
So when you say about doing exercise, a lot of people have started looking up on online platforms and doing the same thing at home. Now, if there's nobody guiding me कि आपका जो form है वो गलत है, आपका posture गलत है, there might be a situation where I'm doing the wrong exercise that is kind of worsening my pain.
Correct.
So how do you regulate that?
Right. See, if you're already in pain and you try to do some exercise that you find on YouTube, sometimes it may work out in your favor. That is, there is always a chance, but sometimes it can worsen your symptoms.
Right.
So first, I would rather recommend if you're apprehensive, if you're doubtful about it, you get it checked out. You get it checked out by a physiotherapist. And then, if it is not something to worry about, then, I will definitely tell you, yes, instead of directly, engaging yourself in a very heavy duty exercise, I will tell you, work step by step towards it.
Good.
If necessary, I'll even give you a plan as to how you can go about it.
Yeah. So also, this is a very standard mentality in India, I suppose, wherein मुझे pain हो रहा है, there are only two ways to deal with it. Ignore कर दो, अपने आप ठीक हो जाएगा, या बहुत ही हो रहा है तो मैं पैनिक कर जाऊँ. मतलब हमारी ऑडियंस वैसी है, या तो इमीडिएटली कुछ भी होता है इमीडिएट टेस्ट करा लेते हैं या फिर उसको छोड़ देते हैं. आई थिंक मोस्ट ऑफ माय फैमिली मेंबर्स इन द एडल्ट जनरेशन, एल्डरली जनरेशन, दे जस्ट ठीक है आज हुआ कल ठीक हो जाएगा. when's the time to understand that this is something that needs attention and this is something कि normal recovery में ठीक हो जाए?
So the answer lies in your question only. Basically, if your pain or ache is to a point when it is severely debilitating your lifestyle, it is limiting your daily activities that you want to do.
Okay.
Let us say you have to, turn your car keys on, or you have to reach something, you have to reach for the attic and pick up something, and it hurts you, whether it is in the shoulder joint or the knee joint or back, whatever it is. If it is to a point where it is severely debilitating you, you feel like, no, I'm not comfortable with this, then that is a point you should actually get it checked. But if it is, I would say, I would differ that if it is a mild ache for a few days, you can usually tend to ignore it. And most of these pains, they tend to die down.
Okay.
But if it is not, and it is still bothering you, and it is worsening for some reason, then you should not ignore it. I would say the time frame would be anywhere between 10 days to 2 weeks. And if it is bothering you beyond that, it's better to be safe than sorry.
Okay. Because a lot of times I see the mothers in the household. रोज ही कमर दर्द होता है, काम के वजह से हो रहा है, छोड़ दो, काम तो चलती रहेगा, जिंदगी चलती रहेगी. That kind of mentality, keeps them going. And I think because they get so busy that they forget about the pain.
Correct.
So they're so used to the pain, it's just 4 दिन तो दर्द हुआ, मालूम है अगले महीने वापस आएगा, चले जाएगा, अपन काम करते रहो. So there is something I feel that there has to be some line, but like you mentioned, 15 days to 20 days.
Correct. No, but still, if it is like that, like you gave the example of an Indian housewife,
Woman,
where she occasionally keeps feeling that pain, right? Then most of the time in such scenarios, we have to fix their lifestyle. Whether it is whether it is the posture in which they're working, or if it is a sedentary lifestyle. Most people are of the opinion that when I speak to a similar situation, when I speak to a lady like that, then she'll tell me, most of the times I'm busy in the kitchen. I'm walking around, running around here and there. Don't you think that is sufficient? But I tell, no, that is not sufficient. You being on your feet is not equivalent to you doing
Exercise, correct.
So, everybody, I would say, requires at least 162 hours, or to that matter, at least 2.5 to 3 hours of weekly exercise.
Correct.
That means roughly about 30 to 45 minutes of exercise every day.
All right.
Aerobic exercise, in which you are working out your muscles, your joints, your lungs. It should basically, I would not say completely tire you out, but it should semi-exhaust you.
Correct. So, also coming to lifestyle and management as a product, we've seen lately that people have been advised to manage their weights, their body weight. So a lot of times when somebody wants to undergo a knee surgery, they say that till the time you don't control your body weight, it's going to be really hard to sustain. Yet we also see people that barely do anything about it. So what's the story like there?
Yeah. So see, weight, your ideal weight target, which is how much weight should you be according to your age and height, that is your BMI. Is always good to be within that weight range to avoid unnecessarily complications, especially joint related complications. So if you have some form of a back pain or hip pain or knee pain, weight management is definitely a very important strategy that one should follow in terms of reducing their weight. Nutritionally, whatever is required to be addressed to reduce their weight, it will definitely help them. But I would not say that is the only whole and soul thing, but that is one of the major chunks of, contributing to that factor.
Okay. Weight. So when you take a call of getting surgery done, is this something a doctor should maybe tell a patient first that I would suggest for a while you work on the weight, you manage that? Because post-surgery, what happens, say in an Indian setting, you're taking rest for a while. So you're not doing kinds of movement or anything. So you tend to gain weight because you're resting, you're not on your toes, and you're maybe eating or however that works. So there is a chance of spike in the weight as well. Because you're resting. Indian mentality में क्या रहता, rest बोल तो आप you take, either it's कि आप proper rest कर रहे हैं या it is कि आप rest के नाम पे खाली चल रहे फिर and all. So what should be done before considering surgery?
Now, if surgery is the absolute and there's no other way to go about, but if surgery is the last and final option, then weight management is not really I would not say you cannot, because if one is already in so much of debilitating pain, when reducing your weight through physical activity might not be a good strategy. Yes, nutritionally, from a diet perspective, and exercise which you can do with, if it is applicable for you in that scenario. You should, I mean, whatever you can in terms of, you can do, if it is applicable for you in terms of reducing weight, you should, and it will also help you to alleviate the symptoms.
So I think a time has come where the age-old natural things have come back. You know, people want to trust age-old natural things now again. There was a time where allopathy, because it was really fast and relieving pain very quickly, that was the go-to. But I think in today's time, I've seen a lot of audience, they want to go back to natural remedies.
Correct.
So things like, I suppose, ginger oil, Gaultheria oil, sesame oil, these things are generally anti-inflammatory and stuff. So do you think that in today's time with the lifestyle, these remedies still work?
Ma'am, so I'd put it this way. Yes, from an external application, from a topical application point of view, I'm just speaking anecdotally, but for majority of the patients, it tends to help. It will help to make you feel a little more comfortable, but that is not the whole and soul thing. That is, I would say, if you put it in a pyramid, that is one parameter that you can do to, help yourself if you are in pain. But that is not the whole and soul thing. But definitely anything in form of if it is applicable for you, if you apply some sesame oil or ginger oil, like you told in that case, topical application gives that sensory feedback. It's called the tactile feedback to the brain, which in turn will help release, pain relieving chemicals like endorphins and enkephalins, and it will help, with the joint pain. So it is, yes, if it is not contraindicated, that means if it is not, if it is indicated for you, you can definitely apply it. Nothing wrong in it. It's a good strategy.
All right. So there are these words that are working around in a lot of corporate sectors, and I think middle-aged to younger people, like spondylitis. So that is a really funny thing, because these days the corporate structure requires you to sit at the desk for longer hours.
Correct.
Now, if somebody is Googling or looking online for symptoms, it comes down to spondylitis.
Right.
So is that something to be scared of? Is that something which is a very normal thing to happen? Because I think from the name of it, people get worried, oh my God, it's not an age to get spondylitis and all.
Correct.
So what's the whole blurry thing about?
Spondylitis is a very layman's term.
Okay.
So spondylitis per se doesn't mean anything. Spondylitis means, if you break down the word, spondyle means your vertebrae. Your individual spinal bones. Itis means inflammation. So inflammation of the vertebrae is called spondylitis. But why you are having that spondylitis, that is the main thing. Most of the people who think they have spondylitis actually don't have spondylitis. Like I see 50% of the IT crowd that walks into my clinic, they say that I have spondylitis, do some physiotherapy. I ask them, what do you mean by spondylitis? No, I read about it and it says I have spondylitis. No, what makes you think you have spondylitis? No, neck pain is spondylitis. No, they tell me. No, they're in a completely different. They tend to match the words that they see on the internet, and they feel like that's spondylitis per se doesn't mean anything. It can happen because of many reasons. If there is some disc bulge that is there in the neck, inflammation from that is also spondylitis. Wear and tear of the neck or your spinal vertebrae is spondylitis. Most of the times you can have spondylitis in the X-ray, but you cannot have it in physically in the symptoms. That also can happen. Like that. So we should always correlate the clinical picture with the clinical complaint. And if these two are matching, then we can say yes to the patient that yes, it is coming because of this. These are the actionables that you need to do to get yourself out of it.
So it is said that knee surgery can be delayed to an extent. Can physiotherapy or exercise or regular movement, and given with a combination of these natural ailments, really delay the surgery? Is that possible?
Yes, ma'am. This is again contextual. See, if you have like a very advanced form of a knee arthritis, where it's called genu valgus and varum, in which your knees have completely deformed. That means they have moved to the sides, outside or inside. And there is significant loss of balance, or in clinically we say instability. If the patient is feeling that instability, that loss of balance, if they're sitting and getting up from a sitting position, they're getting up, and they're feeling very wobbly. That is, we cannot exactly promise with exercise and all that. It will definitely make them slightly better, but that might not reverse their knee joint pains that they have. But most of the times, if they are having arthritis, exercises and physiotherapy plays a very important role.
Plays a very important.
Yes, one of the things is, like in your earlier question, you asked weight management, that they have to work on it. But from a physiotherapy standpoint, we identify those weak muscles which contribute to knee joint pain. Like if I have to put it in a simple language, see, your thigh muscles, like this, the front muscles are called the quadriceps, the rear muscles are called the hamstrings, the calves, your core muscles, they act like shock absorbers. Okay. So usually with age, these muscles tend to go weak. There's a decline in your muscle bulk also. So because of which, what will happen, most of the weight falls on the joint. So if you strengthen these muscles, you're taking care of the shock absorbing capacity of the knee joint. And in turn, a strong muscle always lays the foundation for a healthy joint. So you should strengthen your muscles. And weightlifting, weight training is actually a very good form of strengthening your musculature.
So there's also this thing about strengthening and stretching. So in my understanding, both play equally important role per the situation. But a lot of times what happens, people say, I've been doing strengthening, so I don't need the physiotherapy kind of stretching. So do both of them go line in line, hand in hand?
Yes.
Or it's
both are the same sides of the coin. When see, for what reason you're exercising, it depends on that. But let's say you are exercising, you're doing weight training, right? You need mobility. You just don't need strength. You need mobility as well. So to get mobility, you put your joint through that kind of stretch to get that mobility. Like let's say I cannot squat. I cannot sit in an Indian washroom, Malasan position. So if I do not know how to squat, I can't just train myself to that position. So I have to train that ability to squat, which is a mobility and which is sort of a stretching exercise. And then I have to work in terms of strength also to get stronger in that position. So like that, both of them are same sides of the coin. So stretching is important, mobility is important, strengthening is important. It's so a little more important than mobility.
So in the kind of situation that you mentioned, that say a person is not able to squat by themselves, so they have to prepare that muscle, that is done by stretching. So this stretching and mobility should be supervised by somebody, by a physiotherapist or a trainer, or you can do it on your own?
Most of the times it's not required. See, unless you are in pain and you want to get it done under supervision, yes, we can help you. But most of the times, if you're a late 20s or a early 30s or late 30s individual, you can try getting yourself into that position. You can try. If for whatever reason there is pain and you're finding it uncomfortable, you can always seek guidance. There's nothing wrong in it. But if I would say if there is, that's like it. Like that.
So can physiotherapy help somebody walk without support again?
Definitely.
It can?
It can. Yes. See, whether you're a neuro patient, when let's say you have a stroke, you have a
brain hemorrhage or
brain
something,
hemorrhage, you have hemiparalysis, or you're a paraplegic, most of these patients, they require long-term physiotherapy. And most of the times these patients, they are made independent. Like from a point of not being able to move
anything.
Even not being able to move their limbs, with time, with guided exercise, under supervision, regularly undergoing exercise and physiotherapy. Most of these patients tend to get independent, not only from a neurological point of view, but even from a joint pain standpoint. Like let's say somebody has knee pains. There is also a very famous, I was just looking at the other day, there's an Insta channel called as Dadi That Lifts. She's roughly an octogenarian, an 80-year-old lady who had very severe knee pains. She started doing strength training. She was initially at a point where she was even finding it difficult to walk because of pain. But once she started strength training, her functionality improved, her pain improved. Strength training always helps you like that. But especially if you're in pain, it is always better to take guidance from a physiotherapist.
So in a lot of cases that I notice, people going for physiotherapy sessions, once they feel all right, they feel that the mobility is back to as it was before some kind of issue, they skip further sessions and they're like, okay, this is the end to the problem. So is that mentality right? Or how do you know when is an end to an issue? Say, I feel fine. I've been struggling for like a month or two and I've come for physio and I've got it done for 2 months. I'm feeling fine. I don't come back to you. So when's a good time to know?
Right, ma'am. So that during your initial consult only, you should be in talking terms with your healthcare professional when it is your physio, and if he's advised you to undergo these many sessions. Basically, when they give you a plan of care, it is not just reduction of pain. That is just a small parameter of your recovery.
Right.
We have to address why is that pain coming? Is it coming because of some muscle is not working optimally, some muscle performing suboptimally? There is weakness in certain groups of muscles.
Right.
So let's say you feel better. You come with knee pain. You underwent some passive therapies. Therapies, money, some TENS, ultrasound. For a few days, you felt better. You walked away. Then after a month, again, you were fine. After a month, again, you started having knee pain.
Correct.
But you stopped your physio there once, but you didn't do the strengthening part. And, then it's obvious that you will tend to have that pain back. So it is not just undergoing passive therapies. It is about, working on those actionables which are required, which form the weak link as to what is contributing to your pain.
Correct.
So we have to work on that.
Okay. Shifting into a slightly advanced area. So these days, I think a lot of young active individuals that are in sports line, they face a lot of sports injuries. I think one of them really common is supposed to be an ACL injury, right?
Correct.
Can you throw some light on that?
Yes, ma'am. So ACL is it's one of the main ligaments inside the knee. It's called the anterior cruciate ligament. What it does is basically your knee joint is like there is a shin bone, the lower bone, and then there is the thigh bone, the femur.
Correct.
So there is a connection between these two bones. So the ACL is the main one. Then behind there is one more thing called PCL, and to the sides there is MCL, LCL. But ACL is the main ligament that forms the attachment between your the upper bone and the lower bone of your knee joint.
Okay.
So basically, when you're playing sports like soccer, football, or badminton, there's a lot of twisting force that happens through the knee.
Correct.
It's a lot of pivoting, changing of direction.
Yeah.
So sometimes during there are a lot of factors as to why ACL can happen. If your knee is stuck in one position and your body moved but your knee did not move, you can end up having an ACL there. Or if your muscles are weak and the demand of that particular force was very much, you will end up tearing your ACL. So ACL is it's like the main ligament that provides stability to the knee.
Okay.
So if activity, the games like soccer, badminton, that is one sport, a couple of sports which actually, injure the ACL.
Okay.
Like that. So that is why, every sports team, they have a good strength and conditioning coach who addresses all these issues. If there is, they should be, they work on many parameters. One of the main things is muscle strength, nutritional deficiencies and all that. So they make sure that these things, so preventative aspect is very important in athletes. So they make sure that strengthening of your muscles and all that is kept in check.
So also to say this athlete is say 2025 and they've been playing and there's a lot in the lifestyle to maintain. There's work coming in, there is sports that you play to manage your health. Now in the long term, to sustain and ensure bone health longevity, what is it that these people need to do on a regular basis? So things like, say, the ortho oil. This is a symptomatic ointment, right? So if you're having, say, today I feel really sore, I glide it on, that is there and I get instant relief. Correct. But in a longer term, for bone health, what is it that these young individuals need to think of from today itself,
right,
so that they can sustain longer?
Right. So there are two aspects, ma'am. One is physiological and the one is physical. So physiological is if there is some vitamin deficiency that is leading to, that can lead to, bones weakness, or there is some nutritional deficiency that can lead to joints weakness. So all these parameters, the nutritional aspect should be get addressed by a thorough professional, by a good dietitian.
Okay.
But then again, to make sure that these things are kept in check and not, they have to strength train regularly. Okay. Strength training is one of the main It's like one of the main magic keys that will unlock your doors to having a healthy bones. Like that. So strength training and fixing yourself nutritionally is very important.
So in the lifestyle today, earlier, I think, say 20, 25 years back, food was better. The kind of lifestyle was better. Today, there's so much travel, there's so much outing, there's so much socializing that the vitamins that need to be in line and in control
Correct.
are not controlled by the lifestyle itself.
Correct.
So people are thoroughly, depending on supplements.
Right.
So is that okay? Like in today's generation, when we're managing everything, we're managing excessive travel, social life, say exercise, sports, whatever. Is it okay that we can just work with a multivitamin or something?
You can, ma'am. I mean, if there is some deficiency, it's always better to get it checked with your your corresponding physician.
Yeah.
And if they tell you that you have to fix it through vitamins, then you should. But always, natural ways of fixing it is always better, like exposing yourself to at least 20-25 minutes of sunlight every day. That is more important.
Right. So these are things that I think have become really difficult for a generation now. Because one, the kind of places we live in, a lot of people live in apartments. So धूप लेने के लिए या तो छत पे जाइए.
Correct. That is the
एंड खुद के स्केड्यूल में इतना इश्यूज रहता है, कभी ट्रैवल है, कभी कुछ काम का मैनेज करना है, कभी कुछ इवेंट है. तो ये रेगुलर लाइफस्टाइल मेंटेन करना आज के टाइम में मुझे थोड़ा सा डिफिकल्ट लग रहा है, लुकिंग एट माय ओन एज ग्रुप एंड माय लाइफस्टाइल.
correct. Sunlight is a luxury.
या इट इज अ लग्जरी, आई एग्री, इट इज अ लग्जरी. सो क्या होता है, हमको ऐसा है कि आज मम्मी ने रेडी करके दे दिया, हमने ले लिया. अगर मम्मी नहीं है तो हम लेंगे नहीं. मतलब if there is somebody taking care of it, we are gonna take it, we are gonna do it. So I think आज के टाइम में वो मल्टीविटामिन ही मम्मी बन गई है, जिनके लिए जो कॉर्पोरेट लाइफ में है, जो बाहर ट्रैवल करके वर्क करते हैं, दिन भर रहते हैं, ऑन द गो कुछ चाहिए. अब खाना पीना भी क्या, आप घर से कितना ही लेके चले जाओगे, वो फ्रेश नहीं रहेगा. You will not find the best greens in some place. कुछ केमिकली इन्फ्यूज्ड होता है, कुछ नहीं. तो I think for a generation good enough in our age group, say till like 30s, my multivitamins have become the mothers of, I think.
That is there.
That is there, right? I think, and I think, is that avoidable? Given the lifestyle, is that avoidable?
I mean, see, like again, I'm rephrasing it, but if there is nutritional deficiencies which are leading to those vitamin deficiencies, then you have to get it fixed.
You have to get it
and the
fixed.
appropriate person would be your physician.
Okay.
Who will address those issues, like your physician, your nutritionist. Healthcare is a multidisciplinary approach. No one person will help you. Right. So if when it is required in that particular context, that particular healthcare professional will come in to help you with your.
So, Dr. Rahul, there are a lot of myths that have been passed on through generations that I would want you to clarify on and bust. So I just point them out one after the other, and please be honest. So I think one of them, very common, is cracking your knuckles. So some say that you're damaging your bone, but some people really find it appealing to do it. It has become a habit. Just they're sitting and they're going to crack the bone. So what scientifically happens when you're doing that?
First of all, cracking your bones is it's perfectly normal. It does not cause any form of injury or joint damage per se. Basically, there are bubbles, there are nitrogen bubbles that form inside the synovial. So all your joints, all your finger joints, they're synovial joints. So there is fluid inside them. It's called the synovial fluid.
Okay.
So there are nitrogen bubbles that form inside it.
Okay.
And when you do like this, it is basically you're creating pressure inside that joint to burst that bubble. That's all. There is
no degeneration.
Okay.
On it. There's also this, there's studies that say you should not drink water while you're standing. It affects the knees. You should not gulp down water really fast. You should not have water right after food because it affects things. There are a lot of things about water, and mainly you should not drink water standing. So is there some science to it?
No, nothing. You can drink whatever water in whatever position that you're comfortable.
Okay.
But basically, make sure you're hydrated. That's the most important aspect.
So there's no correlation between standing and drinking water. No. Okay, all right. So there's also this concern, which is why a lot of people don't want to get physiotherapy done, is because they have this in the mind that once you start, you have to do it lifetime. You continuously have to do it. There is no getting out. So people don't understand that, and which is why they're a little scared to opt for that.
Right. No, ma'am. Physiotherapy is not a life sentence sort of treatment.
Okay.
It is only done for a short duration.
Sure.
And most of the treatments don't even require you to undergo it every day. I'm talking from a musculoskeletal standpoint, right? Most of the physiotherapy is not required to undergo every day. It is contextual. It is individualized to every patient. How many sessions are required, whether it is required or not in the first place, whether one session of you just understanding your issues, you understanding what needs to be done, what doesn't need to be done. So it depends. It is individualized to every patient. But no, physiotherapy is not something that needs to be done forever. The whole idea of doing physiotherapy is to leave a patient independent, not to be dependent on the physiotherapist in the first place.
Correct.
It is to leave you empowered. It is to leave you into a point where you are doing everything by yourself and nothing is limiting you in terms of physically.
Correct. Okay.
So like that.
So there's also a large chunk of audience, the elderly age group, that believe allopathy is going to down the line, allopathy is going to down the line affect their bodies. So they trust only natural solutions. While I come from a generation, I believe there has to be a blend of both.
Correct.
So is it that either one of them can totally help you cure things? Like if it's totally natural, can you do it, or do you need a balance of all?
No, it's a balance of all. You cannot negate allopathy and you cannot 100% vouch for naturopathy, and vice versa. It is a balance of both. But especially if it is some elderly person or any pain or disease to that matter, first I would rather vouch you get it checked with an allopath, with an appropriate doctor. If and when it is required, you undergo that treatment, and if it is indicated, if it is okay for you, then you can even undergo natural forms of treatment if it doesn't degrade your condition.
So one last myth that is very popularly known: if you're having pain after an exercise, the exercise that you did was wrong. Is there some kind of science there?
No. See, if you're having pain, if you're having pain in the muscle, like let's say you have pain in the mid of the muscle, that is soreness. Soreness is perfectly normal.
No, but once the soreness phase goes, like say I've started gymming and I get soreness for like 3 to 4 days, but then my body gets accustomed.
Right.
Say 10 days later, I do a leg day and then I have pain again. What's that supposed to be?
Pain where exactly do you mean?
Just my legs are paining, my shin is paining,
that is
my
okay.
calf.
That is probably your body is just getting conditioned to that the physical strain of that activity. That is fine. But what is not okay is if it is not coming down, even 1-2 days after your leg days, or if it is hurting inside the joint and it is interfering with your ability to sit to stand or walk or go up and down the stairs, then that is not okay. That means it could mean that there is some soft tissue damage. It could be.
Could be. Okay.
Yeah, it could be. We are not 100% ascertaining it, but it could be. Maybe if you injured yourself doing some activity in the gym. But if that is the case, then you should always get it checked.
Okay. All right. So one final question I would like to ask. There is still a very large set of audience that either chooses exercise. In exercise, they say that if they're, say, maybe playing a sport, that's enough. They're just doing cycling, that's enough. So I suppose there should be a balance of a lot of activities, because I don't think cycling would give you strengthening. I don't think once you're playing a sport, post that if you don't do stretching or strengthening, it'll help you maintain. It's one thing that you do it out of शौक. आप शौक से कर लें वो एक चीज़ है, लेकिन उसको बैलेंस करने के लिए से मैं रोज 1 घंटे वॉकिंग कर रही हूँ, रोज उसके बाद हाफ एन आवर में साइकिलिंग कर रही हूँ, क्या वो इनफ है?
Most of the, especially when we're talking about walking alone is not alone is not sufficient, ma'am. Most people have that myth that I'm walking for 1 hour. That's good. Sure, that is good. Walking is definitely good for you. Walk 1 hour, 2 hours. If you're okay with it, you should walk. That's a good thing. But walking is not alone will not fix your muscle strength.
Okay.
You need to do strength training. You need to strengthen your muscles of your spine, your shoulders, your hips, your knees, your calves. So strength training is equally important.
So no matter what age, you are supposed to be doing strength training, right?
Yes.
Even if you're above 65, 70,
yes.
At that point, if you think I'm just walking, that's enough, इट्स नॉट इनफ,
It's not.
मतलब आपको करना ही पड़ेगा कोई ना कोई, या तो आप फिजियोथेरेपिस्ट के साथ करिए
जी.
या आप घर पे कुछ बेसिक एक्सरसाइजेस कर लीजिए, बट सिर्फ वॉकिंग से तो काम नहीं होगा, राइट?
नहीं होगा, ma'am, नहीं होगा. Under supervision, especially if you are starting out new, it is always better to get it done under supervision, because once you see weight training equipment, it's you don't even know what does what.
Right.
And you don't know if something you'll injure yourself.
Correct.
So it is always better you get it done under supervision.
All right. So as we close, I would like to really thank you for simplifying and clarifying a lot of concepts, wherein you gave technical information where it was necessary, but other parts आपने उसको बहुत simple clarity से बोला ताकि audience भी समझ पाए. So thanks a lot for that session. And I am sure there will be a lot of questions that people will have. So I will stay in contact with you and would like to address लोगों के जो भी concerns or doubts हैं. So I would like to do that. All right, that was a great conversation.
Thank you, ma'am. Thank you as well. Thank you for giving me this opportunity. If this conversation leaves even one person empowered, if it clears confusion of even amongst one person, that's a win-win situation.
Yeah. And as you mentioned in the podcast, I would also like to say to people that, as he mentioned, taking an action is really important. You can't just sit at home and think कि ये pain चला जाएगा नहीं जाएगा. Like Dr. Rahul mentioned, आप उसको डायग्नोस कराइए, मे बी फिजियोथेरेपिस्ट से या ऑर्थोपेडिक डॉक्टर से, जिनसे भी आप चाहे, लेकिन डायग्नोस करा के ट्रीटमेंट लेना इज मच बेटर देन ये सोचना कि वो अपने आप ठीक हो जाएगा. थैंक यू सो मच फॉर वॉचिंग आवर कॉन्वर्सेशन.